For many of us, that sense of connection is something that we crave but don't always feel. That's why the theme of community has been chosen for Mental Health Awareness Week 2025, taking place between the 12th and the 18th of May. So, how important is community when it comes to mental well-being? And what role does it play in helping people to access the support that they need? In short, unsupportive communities both in and outside of the workplace, along with social isolation, all create additional barriers for those facing mental health challenges. Barriers that have their part to play in vastly different mental health outcomes, based not only on the level of support available in the community, but also the parts and type of community that a person belongs to. For example, under the Mental Health Act, people with a mental disorder may be formally detained in hospital or sectioned in the interest of their own health and safety or for the protection of other people. This can be broken down by demographic, age, race, and indices of multiple deprivation, which combines various indicators related to income, employment, education, health, crime, housing, and living environment to create a single measure of deprivation for each area. Case in point, out of nearly 53,000 people detained under the Mental Health Act between 2023 and 2024, 8,254, or nearly 16%, were from the most deprived communities. Similar disparities in outcomes can also be observed when we look at ethnicity. For example, the white ethnic group is the largest in England, so we would expect that out of the total number that this group would have the greatest number of detentions. And at 28,317, this is definitely the case. However, we can also compare detention rates across different groups of people by expressing the data per 100,000 of the population. This is known as the crude rate of detention, and it paints a very different picture. For example, detention rates for the Black or Black British group were the highest at 239 detentions per 100,000 people, which is around 3.5 times higher than the white group at 69.5 detentions per 100,000. The factors behind these outcomes are interconnected, multi-layered, and honestly, enough to fill a whole other video. And although there are many ways in which we should continue to talk about the differences in our experience, on the flip side there are a number of things that we all have in common. Things that you can use as a team member, manager, or business leader to create and sustain a mentally healthy workplace. The question is, what can we do as individuals to create better outcomes regardless of which part of the community we belong to? Firstly, a culture of acceptance is key to creating a supportive workplace community. That's acceptance of other people's beliefs and values, even if and when they differ from our own. To do this, we should familiarize ourselves with the principles of unconditional positive regard, a concept defined by 20th century humanistic psychologist Carl Rogers, who was best known for his theories of personality and self-actualization. He believed that people thrive when they're met with genuineness, empathy, and acceptance. In his book, On Becoming a Person, Rogers defines unconditional positive regard as love and compassion with no conditions of worth attached. It's about creating an atmosphere that simply demonstrates that I care, as opposed to I care, but only if you meet expectations. And although, especially in the workplace, many of us don't experience that kind of acceptance regularly, the best thing about unconditional positive regard is that even the smallest acts of consideration towards those around us can yield significant improvements to rapport, psychological safety, and the mental health of your team over time. Through regular touch points by way of formal and informal catch-ups that build trust, consideration for how the working environment affects the quality of our conversations, alongside being mindful of how different people receive and interpret information. In a previous video, I shared what I learned following 6 months of volunteering at a crisis hotline. Speaking to people about their challenges such as relationship problems, suicidal ideation, or financial difficulties led me to another book called Nonviolent Communication by Marshall P. Rosenberg. Its purpose is to help us connect with ourselves and others in a way that makes compassionate giving natural, where the sole intention is to enrich the lives of those around us absent regard or threat of punishment. Applied internally, it can help us learn from our own limitations without losing self-respect. Applied externally, it can help us build better connections with the people we're closest to, including those we work with. So if, and more likely when, a colleague behaves in a way that doesn't meet your expectations, instead of telling people what we think of them, it's actually more powerful to be able to express which of our needs aren't being met. We can do this by keeping our observations and evaluations separate, as well as improving our ability to express our feelings at any given moment, the significance of which is summed up in a poem called We Wear the Mask by Paul Laurence Dunbar. It highlights the fact that so many of us go around without the language of life, ill-equipped to express what's going on inside without the accompanying alienating thoughts. It's a euphemism for the idea that the more we subjugate our existence to the thoughts and opinions of others, the less connected we are to our own needs and with it our sense of identity. The principles that underpin nonviolent communication teach us to expand our feeling vocabulary while building up the courage to put preconceptions aside and share vulnerability. Because in or outside the workplace, a mentally healthy community starts with small moments of care and connection. However, that care and connection only makes sense if all the members of your workforce can access the support that they need. Scalable solutions across mental, physical, social, and financial pillars of well-being can help to bridge the gap so that no matter where somebody sits in the business, they can still have access to the tools that they need to thrive. This means considering shift workers and remote teams alongside traditional office-based colleagues and recognizing that every type of employee deserves the same opportunities for care and connection. This could be via telephony or on-demand mental health support through an employee assistance program, access to financial well-being tools that help employees track earnings, set budgets, and save for the future, or subsidized membership to local gyms and access to on-demand fitness classes. It's also about how these services are offered. For the avoidance of doubt, they should be easy to use, flexible, and clearly communicated so that no one has to go digging to find out what's available to them. So, how is your organization approaching mental health as a community effort? Let me know in the comments section what's working for you and your team, and of course, don't forget to subscribe for more content that's dedicated to helping you have more accessible conversations about mental health in the workplace and beyond.